2 keys for strong bones: calcium and vitamin D. 1. The importance of bones. Bones play many roles in the body, such as providing structure, protecting organs, and storing calcium. It is important to build strong, healthy bones during childhood and adolescence. But there are steps you can take as an adult to protect your bone health. Bones are constantly changing. New bone is made and old bone is broken down. When you are young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. Most people reach their peak bone mass around age 30. After that, bone remodeling continues, but you lose a little more bone mass than you gain. Your risk of developing osteoporosis, a condition that causes bones to become weak and brittle, depends on how much bone mass you have when you turn 30 and how quickly you lose it after that. The higher your peak bone mass, the more bone in the bank you have and the less likely you are to develop osteoporosis as you age. 2. Factors that affect bones. Amount of calcium in your diet. A diet low in calcium will reduce bone density, lose bone early, and increase the risk of fractures. Physical activity. People who are not physically active are at higher risk of osteoporosis than those who are more active. Tobacco and alcohol use. Research shows that tobacco use contributes to weak bones. Similarly, regularly drinking more than 1 drink of alcohol per day for women or 2 drinks per day for men can increase the risk of osteoporosis. Gender. You are at higher risk of osteoporosis if you are a woman, because women have less bone tissue than men. Size. You are at risk if you are extremely thin, with a body mass index of 19 or less, or have a small body frame because you may have less bone mass to lose as you age. Age. Your bones become thinner and weaker as you age. Race and genetics. You are at higher risk for osteoporosis if you are white or Asian. Also, having a parent or sibling with osteoporosis puts you at higher risk, especially if you have a family history of fractures. Hormone levels. Too much thyroid hormone can cause osteoporosis. In women, osteoporosis increases significantly after menopause due to a decrease in estrogen levels. Prolonged absence of menstruation, amenorrhea, before menopause also increases the risk of osteoporosis. In men, low testosterone levels can cause loss of bone mass. Eating disorders and other conditions. People with anorexia or bulimia are at risk for bone loss. Additionally, gastric bypass surgery, weight loss surgery, and conditions such as Crohn's disease, celiac disease, and Cushing's disease can affect the body's ability to absorb calcium. Certain medications. Long-term use of corticosteroid medications, such as prednisone, cortisone, prednisolone, and dexamethasone, is harmful to bones. In particular, 2 of the most important factors considered to be key to strong bones are calcium and vitamin D. 3. Calcium and bones. Calcium is an important nutrient for building bones and slowing bone loss. But too much calcium doesn't necessarily mean you'll get the results you want. Some scientists believe that too much calcium or dairy products can be bad for your body. Remember that in addition to calcium, there are other nutrients and foods that help keep bones strong, most importantly vitamin D and vitamin K. How much calcium do you need? The recommended daily intake of calcium is 1.000 mg, mg, per day for adults up to age 50 and 1.200 mg per day for people 51 and older. When bone loss accelerates, as people age, their intestines absorb less calcium from the diet, and their kidneys seem to be less efficient at conserving calcium. So your body has to take calcium from your bones to maintain and perform important metabolic functions. It is best to get your calcium from food sources. Some studies have shown that getting too much calcium from supplements can increase your risk of heart disease and prostate cancer. So it is best to talk to your doctor if you think you need a calcium supplement. 4. Vitamin D and bones. Vitamin D is essential for building and maintaining strong bones. That's because calcium, a major component of bones, can only be absorbed by your body in the presence of vitamin D. Your body makes vitamin D when direct sunlight converts a chemical in your skin into the active form of the vitamin, calciferol. If possible, short periods of sun exposure will help your body produce its own vitamin D. About 5 to 30 minutes of sun exposure between 10 a.m. and 3 p.m. Twice a week, on your face, arms, legs or back without sunscreen, will give you all the vitamin your body needs. People with fair skin that burns easily should protect themselves from skin cancer by limiting sun exposure to 10 minutes or less. Vitamin D is not found in many foods, but you can get it from fortified milk, fortified cereals, and fatty fish such as salmon, mackerel, and sardines. Depending on where you live and your lifestyle, vitamin D production may be reduced or almost absent during the winter months. Sunscreen can also reduce vitamin D production. Many older adults do not get regular exposure to sunlight and have difficulty absorbing vitamin D, so taking a multivitamin with vitamin D may help improve bone health. The recommended daily amount of vitamin D is 400 international units, IU, for children up to 12 months of age, 600 IU for ages 1 to 70, and 800 IU for people over 70. When taken in appropriate doses, vitamin D is generally considered safe. Thank you for watching the video. I really appreciate your support. Don't forget to like, share and subscribe to support my channel.